My name is Megan West Allen, and I was a patient of Dr. Hines at Mississippi Reproductive Medicine. I think, like a lot of girls, I always knew I wanted to have kids. So my husband and I had been married for a few years when we felt like it was time to expand our family. It didn't happen as quickly as we thought, so I mentioned it to my doctor, to my gynecologist, and we tried some medications, some Clomid, and I didn't respond. And that's when she said she thought it was time for me to go see a reproductive endocrinologist and get some extra help, but she felt like I'd be back to see her and I'd be pregnant with my first child in just a few months. So I started having these dreams. I just knew that we were going to immediately get pregnant with twins and be bringing home a baby boy and a baby girl, and I could just see those cribs in our house and couldn't wait for that moment. So we went to see Dr. Hines, and I remember our first consultation. I loved him, and I thought that he was very candid, and you could tell that he cared so much about his patients. But I also started to realize that this process might not be as quick as I initially thought that it would be. So my husband and I went home with some more information about what all of this would entail, and we started talking about it and tempering our expectations of what expanding our family might look like. So our doctor's appointments continued. And first we started on some pretty simple courses of medicine, some oral medications. And surprisingly, I didn't respond to those either. Month after month after month, we would try these medications and none of them worked. And then I remember sitting down with Dr. Hines and him saying that, it looked like this was going to be a more complex case for us to expand our family, and that probably the only chance for us was to consider IVF. The truth is, this was something we hadn't considered. We thought that after a couple months of oral medications, we would be pregnant and bringing home those twins, that boy and that girl that I had always imagined. So this was a lot to take in for us. Financially, it was a lot to take in. We knew it was not inexpensive to go through IVF. But even more than that, I think what struck me were the odds. I knew that it was not a sure thing, that I could take all these shots and take all these medications and we could still end up without children. So we prayed about it and we talked about it. For us, there really wasn't much of a choice. We knew that this is what we were going to do. So I remember being so nervous about starting those medications. And so we did it. A couple a day, shots a day. I gave my shots to myself because I figured if anybody was going to be in charge of giving myself shots, it was going to be me. My husband didn't have a clue what he was doing either, but he was very supportive. And so we started our medications. And day after day, we would go in for our visits. And I always tell people that I learned to expect the unexpected in those visits. Just when you thought that everything was going exactly according to plan, you would go in for a doctor's appointment and something wouldn't be quite right. But Dr. Hines and Marty were so good about reminding us that this was a marathon and not just a quick sprint, to take all of this in stride and keep the faith and keep the hope that at the end of the day, when this was all over, that we would be able to bring home our child. So after a few weeks of medications, it was time for our egg retrieval. So excited, everything had seemed to have gotten to a very good place. Dr. Hines felt good, we felt good. I remember going into the doctor's office and they put you to sleep for the egg retrieval. And I woke up from my medication, and I knew that something was wrong, but I didn't know exactly what it was. And the only reason I knew is that everyone was talking to me very delicately. My husband was saying, "It's okay, it's gonna be okay," and I didn't know what was gonna be okay. And Dr. Hines had a sort of, not worried look, but concerned look on his face, and I'm still waking up and have no idea what has happened. And so after probably an hour of my recovery, Dr. Hines comes in and tells me that something has happened that has only happened twice before in his career. They couldn't get to my eggs for the egg retrieval. I didn't know what to say, and he didn't really either. He told me that at this point, there could be a couple solutions to that situation. Either that the trigger shot that I had taken hadn't worked, or I might be in the small percent of the population that had some sort of a medical condition that the eggs could not be retrieved, that there was a reason they could not retrieve them, and then in that case, IVF would not work for me. As much as that going through the IVF process is a blur, that moment is still crystal clear, and the next 24 hours after that are still crystal clear. I remember getting back into the car, sobbing, and wondering what was next for us, and spending the next 24 hours wondering if we were ever meant to have those children that I envisioned in our home. I remember Matt and I going home and not really even talking, just sitting and waiting while we waited for the test results from Dr. Hines' office. Did a lot of praying, a lot of thinking, called, I think, every family member or friend I had and asked them to pray for us as we waited to find out what would be next for us in the next 24 hours. Now, fortunately, prayers worked and our luck worked. And as luck would have it, we found out that it looked like everything was okay, and that if I tried a different kind of trigger shot, we could try again for the egg retrieval. Again, Dr. Hines said this was sort of uncharted territory for him and for us. If we even retrieved the eggs at this point, was there some other reason that we couldn't get to them? Would we ever be able to have a child? And certainly, would we ever be able to have a child after this round of IVF? So we went back into the office. I had to gear myself up with much more courage than I had the first time. They put me to sleep. And when I woke up this time, I could tell from the smiles on people's faces that things had gone much better this time around. They were able to retrieve our eggs. Dr. Hines was relieved. I felt like he was part of this with us. It's like we were a team. Marty was relieved. All the nurses were relieved. But of course, we were just at the beginning of this process. The eggs were retrieved. We still had to wait for them to be fertilized and see what would happen next. So they fertilized the eggs. I couldn't even tell you how many made it through that first process, but enough. They sent them off for PGS testing. That was something we decided to do because we wanted to do everything that was possible to ensure that this was a pregnancy that would ultimately result in a baby. So we sent our embryos off for PGS testing. We got the results of that, and then it was time for a transfer. About a month after my egg retrieval, it was time for a transfer. And I think this was the point in the process when I was the most nervous. We knew we had embryos. We knew they were normal and healthy, but we had no idea if a transfer would work, if this would ultimately be that baby that we had dreamed about. I remember having a discussion with Dr. Hines. Do we transfer one embryo? Do we transfer two embryos? And he was so careful to consult us, not tell us what to do, but to lead us in what was probably the best and the healthiest direction for our family. And that was to transfer one embryo. So we go in to transfer that one embryo. I wore the same outfit I wore to my egg retrieval because I was very superstitious and things had gone so well that I wanted to do everything that was possibly in my power, which wasn't much, to make sure that this went as well as it possibly could. So we went in, they transferred our embryo, and I think I spent the next day, took the day off work, just relaxing around our house, watching only happy movies, doing everything I could that was positive, that was happy. I called all my funny friends and talked to them on the phone. I ate warm, healthy foods, anything I could possibly do. And then after that 24 hours, to be honest, I tried to forget about it. I tried to go about my life just believing that this was going to work out. I would get up in the morning and take walks around my neighborhood and try to envision delivering a healthy baby girl, because we knew from our PGS testing that the embryo we had transferred was a girl. So flash forward about 10 days. I had just gone on one of my morning walks through our neighborhood. I was in the living room of my house, folding laundry, about to get ready for work. It was about 9:30 in the morning, an hour after I had gone in for my blood test, and the phone rang. And I had tried not to, aside from envisioning this all working out and me getting pregnant and having a baby, I had tried not to imagine what the phone call would be like. But this was the phone call. So I answered, and it was our nurse, Rachel. And the first thing she said to me was, "Do you feel pregnant?" And I said, "I don't." And she said, "Well, you are." And I'm sure I cried. I don't remember what I said, but I thought, we did it. It took a lot longer than I ever expected, but we did it. And little did I know I had a long pregnancy to go through, but everything we had done and all the prayers for us and all of the work from Dr. Hines and Marty and everyone at Mississippi Reproductive Medicine led us to this moment where we could finally hear those words that we had waited years to hear. We were pregnant. And 9 months later, we did deliver our healthy baby girl, who was everything I imagined she would be. Strong-willed and curious and funny. And every time I look at her, I think, my goodness, everything we went through and all those moments of doubt and worry and wonder were worth it when I look at her. Flash forward another couple years, we went back to Dr. Hines and Mississippi Reproductive Medicine for another embryo transfer. 9 months after that, we brought home my daughter's perfect, precious baby brother. So no, I did not have twins, thankfully for me. But now I have that baby boy and that baby girl that I dreamed of and prayed for so long ago. I know that there's a lot of God and a lot of faith involved in this process, but I also have to put so much of it in the hands of Dr. Hines. I think with us and with his patients, he works so hard to counsel you and lead you into the direction that is right for you and is right for your family. And it certainly was for us. And I see him often, and I know, and I tell him, we wouldn't have these children if not for you, and if not for your nurses, and for Dr. Hines, and for Marty, and for everyone at Mississippi Reproductive Medicine who cares so much and works so tirelessly for their patients. It's tough. It is tough going through infertility. It is alienating, and you do feel alone. But as long as you keep the hope and keep the faith and take the advice of your doctors, you can become a mom. You can become a dad. You can grow the family that you want to grow. And I'll say this too. I did not think I knew anyone who had dealt with infertility until I became a patient of Mississippi Reproductive Medicine. And it was actually in the hallways of the clinic that I met at least 3 very dear friends who were going through the same thing I was. And we sort of became each other's sounding boards through this process. All of us have children today. Through different ways, all of us have children today, and we still look back on those moments of uncertainty and the tough things we went through, and we're grateful for it. I think going through the difficulties we went through to have children, it certainly made me a better mother. It made me more thankful for my children. It made me more aware of what miracles and what blessings they are.